Hello everyone. Today let's discuss about the topic internal carotid artery. Now, as you know, internal carotid artery is the part of the anterior circulation that provides the blood supply to the brain. Here we can see two of them, one on this side, one on this side, and whereas the vertebral arteries over here, coming out of the foramen magnum, which get united to form the basilar artery. Uh, so vertebral artery are the part of the posterior circulation that provide the blood supply to the brain, whereas internal carotid arteries are the part of the anterior circulation. So in this topic, we're going to discuss about the internal carotid artery, that is the part of the anterior circulation of the brain. Here we can see two common carotid arteries. The common carotid artery on this one on the right side is getting divided into the external carotid artery and into the internal carotid artery. Now this bifurcation, this division takes place at the level of C3, C4 vertebral column, or we can say at the level of the thyroid cartilage. Now here in this picture, we can see internal carotid artery getting divided into few segments. In this case, from C1 to C5, and in this one from C1 to C4, and in this case from C1 to C7. Now, division of this internal carotid artery into different segments uh, helps us learn much more in detail the anatomical part of the internal carotid artery. So the first classification was given by Fisher. What he did, he divided internal carotid artery into five segments, but basically from distal to proximal. That is from above to below. So therefore it's called the retrograde kind of classification. Because why retrograde? Because the blood flow from the internal carotid artery is from the neck towards the brain towards the head. That is from below to above, whereas his classification starts from above to below. So that's why it's a retrograde classification. Whereas other classification given by Gibo and Bautelier, both are in the proximal to distal manner. So that is from neck towards the head. So that is the antegrade fashion. So only difference between Fisher and Gibo and Bautelier is this one. And of course, the segments uh, which were given differ from each other. But basic principle is internal carotid artery anatomy is the same, only the segments are named differently. So Gibo classification is from C1 to C4. What he did, C1 was given the cervical part, C1. This is the vertical portion coming from our neck area and going till Petrus part of the temporal bone. Here we can see. So till its origin from the bifurcation till the Petrus part of the temporal bone is the cervical part. Then this is the Petrus part of the temporal bone, hence given the name Petrus segment, C2. Then there's a third part, cavernous segment, C3. It's called cavernous segment because it's inside the cavernous sinus. And above this clinoid area is the area in the middle cranial fossa where we have anterior clinoid processes and the middle posterior clinoid processes. Hence, that area is called the clinoid process. So anything above that, Gibe what he did, he simply called it supraclinoid segment. Now, this supraclinoid segment, of course, is further divided into C4A, C4B, and C4C, depending on which artery is taking origin of the specific artery. For example, this one is the ophthalmic artery. Therefore, C4 is further divided into ophthalmic segment because of the origin of the ophthalmic artery here. Then C4 is further divided into C4 communicating segment, or we can say C4B, because of this posterior communicating artery origin. And the third portion is divided into C4C, or we can say C4 choroidal segment, because origin of anterior choroidal artery is taking place here. So C4, the supraclinoid itself, C4 segment is further divided into three parts: ophthalmic segment, ophthalmic segment here, communicating segment here, and the choroidal segment over here, depending on origin of the particular relevant artery taking origin from that particular segment: ophthalmic artery, communicating artery, and the choroidal artery over here. So Gibbon divided internal carotid artery into four segments: cervical, petrous, cavernous, and supraclinoid. Why supraclinoid? Because this area is the clinoid, which I already mentioned. So above that is the supraclinoid segment. Now let's go to the Boutelier classification, the most recent one. What he did, he kept C1 cervical and the Petrus Petrus segment of the internal carotid artery to remain the same. So there were no modification in the C1 and the C2 part. So C1 cervical segment and the C2 Petrus segment remains the same in both these classifications. Now, further, what he did, he added the LACERUM segment over here, C3. So before going for the cavernous segment. So this C3 is named as LACERUM segment or the lateral segment in the Boutelier classification. This is because internal carotid artery passing above the LACERUM area, above the LACERUM part, going through the LACERUM part. So hence he gave the name to the segment as C3 segment. Then the cavernous segment remains the same as was in the Gibo classification. So we have one in plus. Then clinoid, what he did in the Gibo classification, this area, the clinoid area, which I already talked about, wasn't given any name in the Gibo classification. But Boutelier, what he did, he gave this segment also a name. So hence called the clinoid segment. So hence C5. Rest, what he did, he divided supraclinoid area, which was here in the C4 in the Gibo classification. He further divided the supraclinoid area into two segments. One is your ophthalmic segment because of the origin of the ophthalmic artery over here, and the this one the communicating segment because of the because of the posterior communicating artery and the uh, your anterior choroidal artery over here. So to summarize, for a quick recap, we have three classification represented on this slide. The first one is the Fisher, who gave it in 1938. Now, Fisher classification starts from head towards the toe, from head towards the neck. That is from C1, C2, C3, C4, C5. Whereas other classification starts from neck towards the head. That is from C1, C2, C3, C4, and C1, C2, C3, C4, C5, C6, C7 in Boutelier classification case. Now, C1 and C1 and C2 and C2, cervical segment and the Petrus segment remains the same in both of these classification in the Gibo and the Boutelier. But in Boutelier, he added the C3 segment before the cavernous segment. That is the C3, the LACERUM segment or the lateral segment was added in the Boutelier classification before C4. That is before cavernous. So C4 here is cavernous, but in C3, since there was no LACERUM LACERUM segment included, so this whole area was termed as cavernous over here. Then there was a clinoid segment here, which Gibo didn't talk about, the clinoid segment. But Boutelier, what he did, he gave this segment a name, clinoid segment, because we know uh, internal carotid artery goes medially towards the anterior clinoid process. So hence, this landmark of the anterior clinoid process was given the name clinoid segment. So C5 clinoid segment was also included. Then above this part, the clinoid part, everything was supraclinoid because it's above the clinoid segment. Gibo just simply called it the supraclinoid segment. Whereas Boutelier, what he did, he further divided this supraclinoid segment into two parts, C6 and C7. C6 is because of the origin of the ophthalmic artery, therefore calling it ophthalmic segment, C6. And this one is the communicating segment because of the posterior communicating artery and the anterior choroidal artery origin, which was named C7. Whereas in Gibo, this supraclinoid segment itself is further divided into three segments: C4 ophthalmic segment, communicating segment, and the choroidal segment. Why ophthalmic segment? Because origin of the ophthalmic segment, ophthalmic artery takes place here. Communicating segment because the communicating posterior communicating artery arises here, and the anterior choroidal segment because of the choroidal anterior choroidal artery uh, taking origin over here. So let's discuss much more in detail. Now it's all about the the what Gibo exactly defined. So Gibo, what he did, the extracranial ICA, internal carotid artery, was represented as the C1, and the extradural was subdivided into Petrus and Cavernous segment. So this one is all extracranial cervical area because it hasn't reached the skull base yet. So hence it is the extracranial part over here. Then extradural part. Extradural part is divided into Petrus part over here and cavernous segment. And this one is the cavernous segment. So what what he said, this one is the extracranial and this one is extradural because internal carotid artery hasn't entered the subarachnoid space yet. So hence this is extradural part, whereas this supraclinoid part is all intradural, that is entering the subarachnoid space. So this is all said in that slide. So Gibo said this one is the extracranial part, cervical part, because it hasn't entered even the skull yet. So hence it is outside the skull, therefore extracranial. Whereas Petrus and the cavernous part are inside the skull but outside the dura matter. So therefore it's called these two Petrus C2 and C3 are called as extradural, whereas C4 is called intradural because after this supraclinoid part, C4 segment enters the subarachnoid space, that is inside the dura space, subarachnoid space, below the dural space. So therefore, it's all intradural. So this is all said written in that slide. So extracranial part as C1 and extradural was subdivided into C2 and cavernous segment, C2 and C3, and intradural part is the supraclinoid segment, C4. All right. So ICA segments, as we already mentioned, C1 cervical portion starts from the common carotid artery till the carotid canal. C2 petrous part from the carotid canal to cavernous sinus, and cavernous portion is inside the cavernous sinus itself. And the C4 supraclinoid portion begins at the subarachnoid space and terminates, of course, into anterior cerebral artery and middle cerebral artery, which we will further discuss. Now, according to the Boutelier classification, Boutelier, as I already mentioned, introduced the LACERUM part, uh, which was named as C3 in the Boutelier classification, as we already discussed, and he included the clinoid segment also here. So C3 part, LACERUM part was introduced, and C5 part was introduced. So these were the two main things, C3 and C5, which were introduced by Boutelier. C3 was the LACERUM part, which wasn't in the Gibo classification, and the clinoid part, which wasn't named in the Gibo classification. So C3 and C5 are the main points to be remembered, and of course, the supraclinoid part is further divided into C6, C7. But uh, this supraclinoid part itself is further divided into Gibo classification. So at the level of supraclinoid, at the level of this area and this area, things haven't changed much. Just the only difference in the Boutelier classification is he added two segments, C3 and C5. That is the LACERUM part and the clinoid segment. C3 LACERUM segment and the clinoid segment. So this is all about the botiliar classification, cervical segment, C1, C2 Petrus segment, lacerum or the lateral C3 segment, cavernous, clinoidal C5, ophthalmic C6, and communicating C7. So this C3 and C5, which were added in the botiliar classification. Rest ophthalmic and communicating itself were present in the Gibo classification. Just the only difference was in the Gibo classification, choroidal segment was also introduced, but in the Boutilier classification, communicating itself includes the choroidal segment and the communicating segment. That is the origin of the posterior communicating artery and the origin of the anterior choroidal arteries. Both are including in the communicating itself. So the point to be remembered is C3 and C5, clinoidal, and the lacerum part. Now again, same picture representing the Boutilier classification C7. So now we can easily appreciate cervical part. Then this C2 over here is our Petrus part going through the Petrus bone, temporal bone. Then we have the C3 part. This is the lacerum part over here going through the foramen lacerum over here. Then we have the cavernous part C4, C4 area. This is inside the cavernous segment, cavernous sinus, C4 segment. Then we have the clinoid part. This is a small area which is medial to the anterior clinoid process. And then we have C6 part over here. Now C6 part is the ophthalmic part, ophthalmic segment in the Boutilier classification, because origin of the ophthalmic artery takes place here, which is not shown in this figure yet. Then we have the communicating part. Now communicating part is the part which includes ophthalmic posterior communicating artery and the anterior choroidal artery origin. Both are included in C7 uh, in the Boutilier classification. Whereas in the Gibo classification, this all area from here till above, this all area is known as supraclinoidal area, which has three segments: ophthalmic segment, posterior communicating segment, and the anterior choroidal segment. Again, another image. Here we have the cervical part uh, going from your neck area, from the bifurcation till hasn't entered the skull base, hasn't entered the skull yet. Then we have the lacerum part, Petrus part over here, C2, going through carotid canal inside the Petrus part of the temporal bone, going inside the carotid canal. Then here we have C4, C3 part, C4, C5, C6, C7. So this is the lacerum part. So carotid canal joining the lacerum, foramen lacerum over here, lacerum segment, therefore C3. Then we have C4 over here, the cavernous segment. This is inside the cavernous sinus, C4. Then C5 is the supraclinoid and above, everything above. So this is the clinoid segment, and according to the Gibo classification, this all is supraclinoidal because it's all above the clinoid segment. But Boutilier gave it the name C5 segment. Then we have the C6, that is your ophthalmic segment, and C7 over here is the um, posterior. C7 we have the communicating segment, including the posterior communicating artery and the anterior choroidal artery. Now, this is all about the Gibo classification. Here we can see, as I already mentioned, cervical segment in the Gibo classification. C2 is the Petrus segment with this vertical part giving the genu, and the horizontal part, and then again the vertical part. This is all about the Petrus part. Then C3 is the cavernous part in the Gibo classification. And above that, then is all supraclinoid. So here is all supraclinoid. This area he left out, which was termed C5 segment or the clinoidal segment in the Boutilier classification. But then this, what he further did is supraclinoid segment is further divided into three segments on itself. of itself. So this is your supraclinoid segment. So here we can see C4 ophthalmic segment, because ophthalmic artery over here is taking origin of the ophthalmic arteries, we can see here. So this is C4 ophthalmic segment. Then now this one, second segment, was named as the C4 communicating segment. Now this one is called communicating segment because we have the posterior communicating artery taking its origin at this level. Then we have the C4 choroidal segment over here because of the anterior choroidal artery origin taking place. So these segments were basically named after the origin of the particular artery. Uh, so C4 ophthalmic segment, it starts from the origin of the ophthalmic artery till the origin of the posterior communicating artery. Now C4 communicating artery starts from the origin of the posterior communicating artery over here till the origin of the anterior choroidal artery, and the C4 choroidal segment starts from the origin of the anterior choroidal artery till the internal carotid artery terminates into anterior cerebral artery and into the middle cerebral artery. Again, the same. This is the same image from the posterior view, and here we can see same image of the all the three segments: ophthalmic segment, ophthalmic segment here, communicating segment, and the choroidal segment. Now, as we know, say cervical portion, the C1 segment of the internal carotid artery starts at the in the neck. Now, in the neck, we have the carotid triangle, and carotid triangle itself has a Farabeuf triangle. Now, the significance of this Farabeuf triangle, which is inside the carotid triangle, is that the bifurcation, to be more precise, exactly happens at this Farabeuf triangle, which itself is the part of the carotid triangle. I've discussed about the neck triangles in my another video. So for the more detail, you can go and have a look over there. So Farabeuf triangle is itself is the part of the carotid triangle. It's a triangle uh, which I'll show in the next slide. So here we can see this is the neck area, and this is the carotid triangle. Carotid triangle is the part of the anterior neck triangles in the neck. So this is the Farabeuf triangle included itself in the carotid triangle. Now, importance of Farabeuf triangle is the bifurcation of the external carotid artery into the internal carotid artery and the external carotid artery. Most of the time, usually happens inside this Farabeuf triangle. The borders of the Farabeuf triangle, we can see the hypoglossal nerve, cranial nerve 12 over here superiorly, and here posteriorly we have the internal jugular vein and the common facial vein. Anteriorly and inferiorly, we can see the common facial vein. So these are the boundaries of the Farabeuf triangle. The importance of Farabeuf triangle, therefore, is Farabeuf triangle is inside the carotid triangle and is the triangle where the bifurcation of the common carotid artery into the internal carotid artery and the external carotid artery takes place. Same picture. This is the carotid triangle. Over here, inside the carotid triangle, we have the Farabeuf triangle for the bifurcation of the common carotid artery. Now, as we know, internal carotid artery, while it's passing through the neck area, it is divided into two parts. One is the uh, suprahyoid part. One is the suprahyoid part, and one is the poststyloid part. Why the suprahyoid part? Here we have the hyoid bone. Here we can see internal common carotid artery gets bifurcated into external carotid artery and into the internal carotid artery. So for the relation and for the all the relation and all the anatomical purposes, internal carotid artery is further divided into two parts while in the neck area. Above the hyoid part, therefore, this area would be called as suprahyoid part. Suprahyoid part. Uh, why I'm emphasizing more on this part? Because it helps for the relation of the internal carotid artery while in the cervical region. So this is the suprahyoid part, and then internal carotid artery. Here is the styloid process. Now, now it comes the styloid process. Now this part becomes the post-styloid part. So therefore, internal carotid artery, after its bifurcation from the common carotid artery, when it starts, here is the hyoid bone at the level of the C3 area. So uh, here, till the styloid part, the internal carotid artery is called as suprahyoid part. Whereas once the styloid process, we can see the styloid process over here. Now this internal carotid artery, once it passes near to the styloid process, now is called as internal post-styloid part of the internal carotid artery. Here again, the same image describing our suprahyoid part and the post-styloid part. So here is the common carotid artery dividing into internal carotid artery and the supra and into our external carotid artery. Now the internal carotid artery over here, we can see here is the uh, hyoid bone, should be somewhere here. So this area would be called as suprahyoid part. This area, and somewhere here we have the styloid process. So this area would be known as the post-styloid part. So again, suprahyoid part, which I already mentioned, what is suprahyoid part. So suprahyoid part, as we have already seen in that image, intrajugular vein is the posterior to the internal carotid artery, and the hypoglossal nerve is the one which is lateral and posterior to the digastric belly present over there. So these are the relations which we must know in the cervical region, cervical segment of the internal carotid artery. One must know about the ansa cervicalis and the vagus nerve and the sympathetic chain. Let's discuss about these things. So, as we know, we talked about the suprahyoid part. So that is, we haven't from the above the hyoid bone till the styloid process. We have the suprahyoid part. Now, few relation we must know about in the cervical region of related to the internal carotid artery. So here we have the ansa cervicalis. So this is our hypoglossal nerve over here, cranial nerve 12. Now this is the superior root coming from the hypoglossal nerve, superior root of the ansa cervicalis here, superior root coming from the carotid hypoglossal nerve, superior root, joining the inferior root of the ansa cervicalis. The inferior root of the ansa cervicalis is formed by the C2, C3, C4. So here we can see from the occipital nerve, lesser occipital nerve, C1, C2, and C3 over here. Yeah, right. So ansa cervicalis is formed of the posterior root, is joining the anterior root or superior root. Yeah, so anterior root is also known as superior root, and the posterior root is also known as the inferior root. So ansa cervicalis, we can see in relation to the uh, internal carotid artery is anterior. Yeah, it's anterior to the internal carotid artery. So ansa cervicalis is formed by coming from superior root is coming from the hypoglossal nerve, that is cranial nerve 12, and the posterior root coming from the uh, C2, C3 levels of the uh, nerve roots at this level, posterior root. So they both join and form a chain, a ring kind of. That's why it's called ansa cervicalis, and it's in the anterior part of the uh, internal carotid artery. So one relation we have talked about, that is ansa cervicalis. All right. So ansa cervicalis we have talked about. Then let's talk about the vagus nerve. Now, here we can see the vagus nerve. Here we have the internal jugular vein. Here we have the carotid artery over here. Now, vagus nerve and internal jugular vein and vagus nerve and the carotid artery, internal carotid artery or the common carotid artery, they are enveloped inside a carotid sheath. Now, that carotid sheath uh, envelopes, surrounds these three structures, the internal jugular vein, the vagus nerve, and the internal carotid artery or the common carotid artery. Um, Initial part of the common carotid artery is enclosed inside this carotid sheath. So, vagus nerve is slightly posterior to internal jugular vein, internal jugular artery. Internal jugular vein is on the most lateral part of the this carotid sheath surrounding these three structures, and the internal carotid artery is on the medial aspect of the inside this carotid sheath. So this relation is very important. So again, internal carotid artery on the medial side, vagus nerve between internal jugular vein and between internal carotid artery, and internal jugular vein is on the lateral side, that is on the right side, on the right portion. And if we are talking about the left side, then internal jugular vein will be on the most lateral, that is on the left side, surrounded in the carotid sheath. Again, we have talked about this vagus nerve structure. So we have discussed about the ansa cervicalis. We have talked about the vagus nerve, then about the sympathetic chain. Now, sympathetic chain is, as we know, sympathetic chain, all the fibers of the sympathetic chain going towards the brain inside the skull. Since they are fibers of the sympathetic chain, they can't travel on their own. So they need a support. So they travel through with the help of the internal carotid artery. So sympathetic chain. They are always residing on the internal carotid artery, and this is how they reach the different areas of the brain. So sympathetic chain, and sympathetic chain is on the posterior aspect. Ansa cervicalis, which we already talked about, is in front of the carotid sheath, whereas sympathetic chain is at the posterior aspect of the carotid sheath. Then hypoglossal nerve would be in the lateral position, lateral area, uh, towards the internal jugular vein, anteriorly and lateral, right? So we have discussed about the ansa cervicalis relation to the internal carotid artery. It's in the front. It will lie in front of the internal carotid artery, or to be more precise, in front, anterior to the carotid sheath. So this is the carotid sheath with three structures: internal carotid artery, vagus nerve, and your internal jugular vein. Now, since this is a carotid sheath, sheath is enclosing all these three structures. So ansa cervicalis would be somewhere in front like this, and sympathetic fibers would be posterior to this carotid sheath, which we can't see right now because it would be in the posterior aspect of this carotid sheath. Now again, here we can see the carotid sheath. This is the cross section at the neck area. So here we can see the trachea, we can see the esophagus. Now here's the carotid sheath in the neck area. So in the neck area, internal carotid artery is inside this carotid sheath. Internal carotid arteries in the carotid sheath is medially located. This is the vagus nerve. Vagus nerve is located between internal carotid artery and between the internal jugular vein, which is a bit posterior. And internal jugular vein is the most lateral structure inside the carotid sheath. Now here would be ansa cervicalis, which we already talked about. Ansa cervicalis, uh, whose superior root comes from hypoglossal nerve. So ansa cervicalis will be located here, whereas the sympathetic fibers would be located posteriorly somewhere here, uh, posteriorly to this carotid sheath. So location of the anterior cervicalis and ansa cervicalis and sympathetic chain. So this is all till now we have talked about the suprahyoid portion, the internal carotid artery relation in the neck area till now. Now let's talk about the post-styloid part. Once internal carotid artery ICA passes styloid process. So Uh, Here in this picture, as we can see, we have the parapharyngeal space over here. Then we have the styloid process over here. Internal jugular artery. Once it passes the styloid process, its location is medial to it, but medial to styloid process over here, and medial to the parapharyngeal space, and medial to the medial pterygoid muscles. So uh, for the clinical purpose, for anatomical purposes, internal carotid artery is medial to uh, medial pterygoid muscle and the styloid process, and its location in the post-styloid part, once it crosses the styloid process, is located in this parapharyngeal space, which is located in this area, green area. So this is parapharyngeal space, all this area. So post-styloid part of the internal carotid artery is located in the parapharyngeal space. Simple. Now again, here we can see the styloid process. So till till this area, internal carotid artery was called suprahyoid part, and after this it's called as post-styloid part. So till now we have just learned about the C1 segment, the cervical segment. So cervical segment is divided into uh, suprahyoid part, which is above the hyoid bone, and post-styloid part, which is after passing internal carotid artery passes styloid process located over here, right? So and cervical portion hasn't is extracranial because it hasn't reached skull yet. So cervical segment was still here. Again, parapharyngeal space over here, and this is the post-styloid part, and here we can see internal carotid artery in the parapharyngeal space over here, and located this parapharyngeal space location is medial to the medial pterygoid muscle over here. Here in this image, we can see styloid process a bit elongated, I can see. So this can create elongation of the styloid process, can cause the dissection of the internal carotid artery, and of course, then that can lead to many problems. So this area, as we can see, this would be called as post-styloid part of the cervical segment or the C1 segment. And now, once entering into the skull, we will call it, this is the C1 segment till here. Then later on, once entering the skull, it will be called as Petrus segment, that is the C2 segment. Again, this image, now here we have the hyoid bone over here, this one over here. So this portion would be called as, uh, this area of the internal carotid artery would be called as suprahyoid segment, suprahyoid part. And we have discussed all the relations in context of this area. And above this styloid process, internal carotid artery would be called as uh, post-styloid portion of the C1 segment. Now, here we have two carotid arteries going bilaterally of the to the thyroid cartilage and the thyroid gland. Now, just as internal carotid artery is about to reach the skull base, there are few different points which we must be familiar with. One is in relation of the ICA to the accessory nerve, and it's when it's almost about to reach the skull base, and when it reaches the skull base, we must know about the two nerves. One is the Jacobson nerve and one is the Arnold's nerve. Jacobson nerve is the a part of the glosso, is the nerve of the cranial nerve 9, and Arnold's nerve is of the 10. So we must remember, as the internal carotid artery, as as it's almost there to reach the cranium, uh, it has its relation, internal carotid artery relation to two nerves, two branches. tympanic branch of the Jacobson of the cranial nerve 9, and the Arnold's auricular branch of the vagus nerve. So one must be familiar with these few points for the exam purposes also. And before, when it's almost about to reach but hasn't reached the skull base, over there we must remember about accessory nerve relation and internal jugular vein relation. So let's talk about these. Now, since we can see here we have the accessory nerve, so here we know that we are talking about near to the skull base. We aren't talking about that internal carotid artery is all has reached the skull base. It's almost about to reach the skull base. So therefore, we talk about the accessory nerve. Now, accessory nerve, know we have as we know we have the cranial root and the spinal root. So right now we're gonna talk about the relation. Now we can see vagus nerve and accessory nerve both are traveling on this area of the uh, internal jugular. So internal carotid artery is in relation to the accessory nerve and vagus nerve, and here would be your internal jugular vein somewhere. So we must be familiar with the relation of internal carotid artery to the accessory nerve, because the relationship between the internal carotid artery and the accessory nerve varies. Nerve can be located posterior to the internal jugular vein or can be located between the vein and the ICA. All right. As we know, accessory nerve supplies the supraclinoid mastoid muscle and helping to shrug our shoulders. Yeah. So now here we can see internal carotid artery has reached the skull base. Has reached. For the accessory nerve, it's about to reach, but for when internal carotid artery is almost about to is has reached the skull base, now we can see we have this is the internal jugular foramen, and here we have the carotid canal. Yeah. So ICA over here, internal jugular vein. Now they both separate. Before, as I said, they were enclosed inside the carotid sheath, but now internal jugular vein goes posteriorly into coming down from jugular foramen, and internal carotid artery going inside. And here we can see the Arnold nerve and the Jacobson nerve. So here we can see Jacobson nerve, part of the internal glossopharyngeal nerve, cranial nerve 9, and the Arnold nerve coming out of the vagus nerve. They both enter into small foramina to supply different parts. So here we have the Jacobson nerve, and here we have the Arnold nerve. Arnold nerve coming from the cranial nerve 10, and Jacobson nerve coming from the cranial nerve 9. And as we know, we have all the we can see cranial nerve 9, 10, 11. Yeah, so these cranial nerves, they all are traveling through jugular foramen. So that's why we have jugular foramen syndromes, uh, which we will discuss in some other video. So because these all important nerves are traveling along with the internal jugular vein in the posterior side in through the jugular foramen, whereas we can see internal carotid artery going inside the skull along with some sympathetic fibers. Now, till now it was all about C1 part, cervical segment. Now, C2, the Petrus portion. The Petrus portion starts from the carotid canal by the till internal carotid artery reaches the cavernous sinus. So this is a C2 Petrus portion from the carotid canal till cavernous sinus. This is according to the Gibo classification. Now, this is the Petrus segment. Now we will discuss about the Petrus segment. So this was the cervical segment all. Now, here in the skull base, carotid artery enters the carotid foramen, that is the carotid canal. So in the Petrus part. So now this Petrus part, as we can see over here, has a vertical segment, has a genuine, and has a horizontal part. All right. So this is all Petrus part inside the Petrus bone of the temporal bone. Petrus part of the temporal bone. So There we can see, uh, hence C2 segment, the Petrus segment is comprised of vertical segment, vertical part, a genu, a angle, and a horizontal part. So these are the part of the Petrus segment. Let's discuss about it. Now, again, this image representing the Gibo classification. So we already talked about the C1 cervical part. Now it has entered the skull base. Therefore, the inside the carotid canal, inside the Petrus part of the temporal bone. Here we can see the Petrus part, Petrus bone. So here we can see, once the internal carotid artery enters the Petrus part or the skull base or the carotid canal, it represents the Petrus segment, that is the C2 segment. Now, inside this P2 segment, inside this C2 segment, the Petrus part has a vertical part, a angle, that is a genu, and a horizontal part over here. Yeah. So this is all uh, Petrus part over here, and a vertical part too. So again, we can see here in this picture, C1 segment, the cervical segment ends over here, because now internal carotid artery enters the Petrus part through carotid canal. Here we can see the carotid canal. So this is named as, inside the Petrus part, it would be called as Petrus part, with this angle and a horizontal part over here. All right. Now this is about this one was the Gibo classification. This is the Boutelier classification over here. So we can see Petrus part over here, and later on this one C3 would be the LACERUM part, because the carotid canal is the continuation with the LACERUM part of the bone. It's the cartilage over there. The cartilaginous structure is the LACERUM part. So therefore, carotid canal gets in continuity with the LACERUM part. Where the Boutelier, what he did, he classified this C3 into, called it as a C3 segment, LACERUM part. Then C3, as we can see, which we'll talk later on, C3, the LACERUM part, limit is this petrolingual ligament. All right, so C3 is till petrolingual ligament, PLL. All right, so we'll discuss about it later. So right now we are focusing on the C2 Petrus part. Again, we can see we have the C1 segment. Now, here's the temporal bone, Petrus part of the temporal bone, having carotid canal. Now, this Petrus segment, this C2 segment has entered the internal carotid canal inside the Petrus bone, giving a vertical segment over here, vertical part. Here we can see vertical. Here, making an angle called the genu, and the horizontal part. We can see here the horizontal part. So this is all the Petrus part. Till now, till here, this area, as we can see, because this is below the Petrus part, is all C1 segment. And to be more precise, if we remember, as I already discussed, this is the styloid process. So this area of the in C1 segment is known as the post-styloid segment. Post-styloid segment over here. All right. So this is the Petrus segment. Again, this image describing C1 segment. Now here we have the Petrus segment with the vertical segment with the genu and the horizontal segment over here. So yes, we are done with it. Yes. Now, talking about the C2 branches. Now, now here we can see this is a C1 segment. This is the Petrus segment. Petrus segment having a vertical part, a genu, and a horizontal part. Here we can see the C2 branches. We will talk about the main C2 branches. One is we can see the corticotympanic artery over here, corticotympanic arteries uh, on this side. Yeah, so one must know about the corticotympanic arteries, and we will have the Vidian artery, and here we have the Vidian artery over here. So it also comes from the horizontal part uh, of the C2 Petrus part. All right. So we can say corticotympanic artery arises from the proximal area from the genu of the horizontal part of the C2 segment, whereas the Vidian artery arises somewhere here. All right. So it's on the distal part of the horizontal segment of the C2. So two branches one must be familiar with: corticotympanic artery and the Vidian artery. Now let's come to the C3 or the cavernous segment. Now C3 cavernous segment it starts from the petrolingual ligament till the anterior clinoid process. Um, Now C3 segment is also known as the cavernous segment because it's inside the cavernous sinus. That's a start. You can see in this picture uh, representing cavernous segment over here, C4, or C4 according to the Boutelier classification, or C3 according to the cavernous segment according to the Gibo classification. So whatever the case, s- uh, cavernous segment starts from the petrolingual ligament over here, PLL, till the anterior clinoid process or the clinoid segment over here. So all this is inside the cavernous segment, hence therefore called as the cavernous uh, C3 or cavernous segment. So cavernous segment, it starts from the posterior petrolingual ligament till the anterior clinoid process, because thereafter internal carotid artery would be called as um, clinoid segment. Now here we can see internal carotid artery. Internal, here we can see anterior clinoid process. So above this, over here, this part would be called as the clinoid segment. Here's the cavernous segment over here. Yeah, because it's inside internal carotid artery is going through the cavernous sinus. We will talk about this proximal dural ring and the distal dural ring too. Now over here in the cavernous segment, the internal carotid artery has two rings. Internal carotid artery is um, surrounded by the dural matter in a dura matter anteriorly. Posteriorly is not surrounded, but anteriorly and laterally, internal carotid artery is surrounded by dura matter, which is anteriorly, we can call it as the collar, dural collar over here in the anterior aspect of the internal carotid artery, which is surrounding the internal carotid artery anteriorly and laterally. So this is the proximal dural ring, and this is the distal dural ring surrounding the internal carotid artery, as we can see in this image. All right. And this kind of forms a collar, hence it is called the dural collar of the internal carotid artery at this segment. Again, this same picture representing same thing. We have the proximal dural ring and we have the distal dural ring over here. Yeah. Now this is the posterior view. So posteriorly, internal carotid artery is not completely surrounded by this uh, dura matter. So therefore, that's why it kind of forms like a collar intersecting like this. So therefore, this is called as dural collar. Here we can see this is the cavernous C3 segment, or C4 segment in the Boutelier classification. This is the cavernous segment of the internal carotid artery. Now, as we have already mentioned, as I've already mentioned, internal carotid artery starts. The cavernous segment of the internal carotid artery starts from the petrolingual ligament (PLL) and till the anterior clinoid process. So here's the anterior clinoid process, and here we have the posterior petrolingual ligament. So internal carotid artery, the cavernous segment is drawn here. So cavernous segment also, just like the Petrus part, has the vertical part, then a posterior genu, a posterior angle, horizontal part, the anterior genu, the anterior angle, and then the vertical part. Whereas the Petrus part, as we remember, just had a vertical and horizontal part basically. This one has the posterior genu and the anterior genu as well, and two vertical parts. This one is the posterior vertical part, and this one is the anterior vertical part. So this is the cavernous segment. Cavernous segment. Now about the few branches of the cavernous segment, we can see one is the uh, main one is the meningohypophyseal trunk taking place, and this one is infralateral trunk taking arising on this side of the cavernous segment. So this MHT, the meningohypophyseal trunk, as we can see, is rising somewhere near to the vertical area and towards the posterior genu, whereas the inferior lateral trunk is the one which is arising from the um, lateral lateral side of the internal carotid artery cavernous segment over here. So cavernous segment arises from the PLL till the anterior clinoid process. Again, the same image representing the cavernous segment over here. Now, as we already discussed, C1, cavernous cervical segment, Petrus segment, with this is the carotid canal, and C3 over here is the LACERUM segment because LACERUM part. So this is the Boutillier classification. Then we have the petrolingual ligament, and further to the petrolingual ligament till the anterior clinoid process, we have the cavernous segment, which is inside the cavernous sinus. Now here we can see in the cavernous segment, we have the proximal ring, we have the distal dural ring over here, then we have the anterior clinoid process. So this is the vertical part, vertical horizontal part, sorry, of the internal carotid artery in cavernous segment. All right, and here we have the anterior clinoid process. Once internal carotid artery passes this dural ring, distal dural ring to be more precise, when internal carotid cavernous segment passes through further towards the distal dural ring, the internal carotid artery enters the subarachnoid space. All right, into the this one is the clinoid segment, and over here it passes the subarachnoid space. So this is the clinoid segment over here. Now again, we can see in this image proximal dural ring, and we have the dissection of the distal dural ring. Now here in this image, we can see, as I already mentioned, proximal dural ring and the distal dural ring incruciate at the posterior aspect. They are not completely enveloping the internal carotid artery when seen from the posterior view. Here we can see the cavernous segment, vertical part. Here we have the posterior genu giving rise to meningohypophyseal trunk. Then we have the horizontal part giving rise to infralateral trunk. And then we have the vertical part. So over here we can see in the clinoid segment, we have proximal dural ring and the distal dural ring over here. So once internal carotid artery passes above distal dural ring, it enters into the subarachnoid space. So C5 here is the clinoid portion. So this is all the clinoid segment. So all we are talking about, since we have the anterior clinoid process here, this is all the clinoid segment, which wasn't named in the Gibo classification. It was simply left out. But Boutillier, what he did, he named this segment as the clinoid segment, where we have the proximal dural ring and the distal dural ring. And uh, internal carotid artery, once passes the further to the dural this clinoid segment, it enters the subarachnoid space. So here we can see clinoid segment over here, and this all area would be now into the subarachnoid space, that is uh, intradural, everything. Now let's talk about the cavernous sinus. As we can see, here is the region. This is bilateral on the sphenoid body. Here we have the sphenoid body with the dorsum celli, and the sella turcica over here with the pituitary gland and the stalk in the center. So cavernous sinus is located bilaterally on either side of this area, body of the sphenoid bone. Now, inside the cavernous sinus, we can see we have the internal carotid artery and few nerves. So, internal carotid artery, along with the cranial nerve 6, are the part which are inside the inside the cavernous sinus, whereas these nerves are inside at the border of the this cavernous sinus, which are in themselves enveloped inside, enclosed inside the dura mater. So uh, contents of the sphenoid sinus, cavernous sinus, would be internal carotid artery, and we can say cranial of 6 also. All right. Res 3, 4, 6, 3, 4, and ophthalmic branch and trigeminal, these nerves, they are all on the periphery branches. And here we can see cavernous sinus, is already talked about, is we can say is lateral to the dorsum celli in this structure, and including the internal carotid artery. So this area, internal carotid artery, with its is coming from below, and it enters. So it gives a vertical part. Then this is now in this picture we can see we have the horizontal part, and again we will have a vertical part. So this all is the cavernous segment of the internal carotid artery. All right, we can see again the proximal dural ring, distal dural ring in this, and therefore this is the clinoid segment, which wasn't named in the Gibo classification, but Bautelier gave it the uh, assigned it a number, and that was C5. Again, here we can see the vertical segment, posterior segment, horizontal segment, vertical segment of the cavernous sinus. So here we can see the cavernous sinus once we have taken out the dissected it and looking laterally. Again, cavernous sinus, vertical portion, horizontal portion, vertical portion. And here we can see the clinoid segment after the cavernous segment. The clinoid segment, because it's medial. This segment is clinoid segment because this is the anterior clinoid process, and internal carotid artery, as we can see, going medially towards the internal carotid process, anterior clinoid process. So this is the clinoid segment. Here we can see infralateral trunk and the meningohypophyseal trunk origin. Now, cross section of the cavernous sinus. Here we can see the pituitary gland in the sella turcica. Here we have the optic case, and here we have the internal carotid artery. Here we have the abducens nerve. So, more exact content of the cavernous sinus are the internal carotid artery and the abducens nerve C6. Whereas three cranial of 3, cranial of 4, trochlear nerve, your V1, V2, and V1 and V2 um, uh, would be on the lateral aspect of the cavernous sinus. They themselves aren't the content of the cavernous sinus. They are enclosed inside the two layers of the dura mater over here. Here we can see the sphenoid sinus. Now, main branches of the C3 segment, the cavernous segment, were the meningohypophyseal trunk and the infralateral trunk. Now, these meningohypophyseal trunk, as the name says hypophyseal, that is we are talking about the pituitary gland. So their main structures which they supply are the pituitary gland and the dura mater. Here we can see the meningohypophyseal trunk, a part of the a branch from the cavernous segment. Here we can see the infralateral trunk, also the part of the cavernous segment. Now this is the corticotympanic artery, which is the part of the Petrus part. So as we already said, Petrus part, Petrus segment gives two branches, the main two branches, the corticotympanic artery and the Vidian artery. All right. So here we can see C1 segment doesn't give any branches. C1 segment, the cervical segment, doesn't give any branches. C2 segment mainly gives two branches, corticotympanic artery and the Vidian artery, represented here, Vidian artery and the corticotympanic artery. Then C3 segment, this is the LACERUM part. No branches, nothing arises here. It's just because the internal carotid artery just passes above it, passes through it, without giving any branches here as well. Then, because C3 LACERUM part itself isn't any space, it's just a cartilaginous part. Then we have the C4. This is our cavernous part. So in cavernous part, we have the main two trunks, meningohypophyseal trunk, which gives the main branch, meningohypophyseal artery, and we have the infralateral trunk over here. So two arteries from the cavernous segment, two from the C2 segment. So it's simple to remember. C1, no branch. C2, two branches. C3, no branch. C4, two branches. Simple. Then C5 is the clinoid part. C5 is the clinoid part, which clinoid process, which is medial to the clinoid process, hence again no branch. Then we have C6 part. C6 part, this is the supraclinoid part. And C6 segment would be the ophthalmic segment, therefore hence giving the ophthalmic artery. And C7 is the communicating part, therefore giving the uh, posterior communicating artery and the anterior choroidal artery over here. All right. Again, infralateral trunk itself, the infralateral trunk, which was coming from the cavernous segment, itself gives many branches, named differently: superior branch, anterior branch, and the posterior branches. Now we have the C4 supraclinoid portion, which gets started from the anterior clinoid process till the sylvian fissure, where it gets branched into two terminal branches, anterior cerebral artery and the middle cerebral artery. So this is a supraclinoid portion starting from the ACP till the sylvian fissure, where it terminates into ACA and MCA. Here we can see supraclinoid part. This is the clinoid portion. Supraclinoid portion getting divided into ophthalmic segment, communicating segment, and the choroidal segment. Ophthalmic segment because of its origin of the ophthalmic artery. Segment, communicating segment because of the origin of the posterior communicating artery, and the choroidal segment because of the origin of the anterior choroidal artery. So supraclinoidal segment is divided into three areas, three segments: ophthalmic segment, communicating segment, and the choroidal segment. Now, uh, branches, as I already mentioned, branches of the C4 would be before it terminates into the anterior cerebral artery (ACA) or middle cerebral artery (MCA). It gives a few arteries: ophthalmic, anterior choroidal, posterior communicating, and the superior hypophyseal arteries. The main three one are the ophthalmic, anterior choroidal, posterior communicating artery, which helps in dividing the supraclinoid segment into three segments. Here we have the again the region of the dividing. This is the cavernous segment. Now clinoid segment is over here. This is the anterior clinoid process. Medial to it is the internal carotid artery passing medial to the anterior clinoid process, ACP, hence named as C5. Rest, we have the superior clinoid segment, which will be further divided into three segments: ophthalmic, communicating, and the posterior and the choroidal segment. Here we can see, according to the Gibo classification, as you already mentioned, C1 segment is the only segment which is extracranial. Then we have two segments which are extradural. One is your Petrus portion over here, and one is your cavernous segment. That is C2 and C3 are your extradural portion, and intradural portion is supraclinoid portion according to the Gibo classification, which is C4. That is supraclinoid. It's intradural, hence it's all this area is all inside subarachnoid space. Here we can see circle of Willis. Here we have posterior communicating artery. Here we have the anterior choroidal artery. So posterior communicating artery is the first branch. Then the anterior choroidal artery is the second branch. So this area is the communicating the communicating segment. This area is the choroidal segment over here. Now here is the anterior communicating artery and the anterior cerebral artery, which we are not talking about in this slide or this topic. C4 segments, as I already talked about, have the ophthalmic segment because of the origin of the ophthalmic artery, communicating segment because of the origin of the posterior communicating artery, and the choroidal segment because anterior choroidal artery uh, arises in this segment. Image representing supraclinoid segment. Here we have the ophthalmic artery, therefore ophthalmic segment. Posterior communicating artery starts where the posterior communicating artery arises. Choroidal segment where the anterior choroidal artery arises. Rest the terminal branches of the internal carotid arteries, which gets divided into anterior cerebral and middle cerebral. Now there are a few perforators coming from these segments as well. So one is the first ophthalmic segment gives rises to the superior hypophyseal artery. Now superior hypophyseal arteries, as the name suggests, hypophyseal from the pituitary, therefore supplies the um, pituitary gland and the stalk, which is the infundibulum. Communicating segment usually doesn't have any branches, but it has only two or three communicating branches, perforating branches. Choroidal segment also has two or three choroidal branches, perforating branches with less importance. So main are the ophthalmic segment also, along with the ophthalmic artery, gives superior hypophyseal artery. Now, superior hypophyseal artery supplies the floor of the third ventricle and the optic nerves and the pituitary stalk. Yeah. Now there are infundibular arteries also. The infundibular arteries, sorry, would give rise to arteries which supplies the stalk, and therefore superior hypophyseal arteries and the infundibular arteries together form the circuminfundibular anastomosis complex of these plexus, which would supply the anterior lobe. Then we have the inferior hypophyseal branch coming from the meningohypophyseal trunk, which was a part of the cavernous segment, supplies the posterior lobe. Then we have the capsular arteries, which will surround all the capsule of the pituitary gland. Here we can see the superior hypophyseal artery, which is a perforator artery coming from which is an artery coming from, or a perforator we can say, which is coming from the ophthalmic segment of the supra C4, and supplying the anterior part, and the uh, along with the infundibular arteries supplying the stalk of the pituitary gland. Whereas the inferior hypophyseal artery, which is a branch of perforator or a branch from the meningohypophyseal trunk (MST), which is a part of the cavernous intracavernous segment, that is C3 in Gibo classification, or C5 in your Boutillier classification. This one supplies the posterior lobe over here. Posterior lobe, as we know, is the neurohypophysis, uh, which doesn't have any vascular arteries. Itself is a part of the neuro bundle, and the uh, not a doesn't have any vascular area. It's all about the nerve fibers coming from the hypothalamus. So posterior lobe is supplied by the inferior hypophyseal artery, which is a part of our inferior hypophyseal artery, which is a part of our meningohypophyseal trunk, that is MHT, which is a part of the cavernous segment, whereas superior hypophyseal artery is a part of ophthalmic segment, that is part of the C4 in the Gibo classification, or C6 in the Boutillier classification. Now again the same image. Here we have inferior hypophyseal artery coming from the meningohypophyseal trunk, supplying the posterior lobe of the pituitary gland, whereas superior hypophyseal artery coming from the ophthalmic segment, supplying the anterior lobe. Then plus we have the infundibular arteries, which supply the stalk of the pituitary gland. Now ophthalmic artery itself. Now this image we have already discussed about. This is the clinoid segment with the proximal ring and the distal ring. Above that, uh, this is the supraclinoid. Since the clinoid ACP, anterior clinoid process, is here, the internal carotid artery enters the subarachnoid space, and all this region is known as the internal carotid supraclinoid segment. Sorry. Here we have the ophthalmic artery. Ophthalmic artery uh, rising arising from the um, ophthalmic segment of the supraclinoid segment, ophthalmic segment, and here we have the in ophthalmic artery, further giving the central retinal artery and other branches. Here we can see internal carotid artery over here giving rise to the ophthalmic artery, which further gives central retinal artery and other branches like posterior ciliary arteries and extra. Then we have the second segment, which was communicating segment, comprising of posterior communicating artery. Now, posterior communicating artery arises from the posterior medial surface of the C4. Here we can see internal carotid artery, posterior communicating artery coming from the posterior medial aspect of the internal carotid artery. Then posterior communicating artery also gives a few branches like premammillary artery. Premammillary artery supplies the third ventricle and a few areas like optic tract and mammillary bodies. Here we can see posterior communicating artery giving premammillary artery supplying mammillary bodies. Then the last artery in the communicating segment of the internal carotid artery, the C7 segment, according to the Boutillier classification, or C4 classification, according supraclinoid segment, according to the Gibo classification. It is the anterior choroidal artery. It's a important artery because it supplies many areas in the brain. Its course is lateral to the optic tract, basically. Here we can see the anterior choroidal artery supplying many important structures like globus pallidus, thalamus, optic tract, and many areas, amygdala. So it can, it, if there's occlusion or thrombosis in this area, it can give a very distinctive clinical picture. Here we can see anterior choroidal artery uh, going towards the choroidal fissure, and before the choroidal fissure, it's a choroidal segment and the plexal segment, and going towards the choroid plexus. Here we have the anterior choroidal artery, cisternal segment, and the plexal segment. The cisternal segment over here, and till the choroidal fissure, and plexal segment is going to the choroidal fissure, choroidal plexus of the um, lateral ventricle and the third ventricle. So therefore, plexal segment, and cisternal segment is till it reaches the choroidal fissure. Now, again, anterior carotid artery and anterior choroidal artery segments are the cisternal segments, which is from the choroidal fissure till the lateral geniculate body, and the plexal segment is through the choroidal fissure to the choroid plexus of the temporal horn, that is the lateral horn. Now, anterior choroidal artery also gives few branches, few from the cisternal branches, which will supply the optic tract, uncus, peduncle, temporal horn, lateral geniculate body, hippocampus, dentate, gyrus, fornix. Plexal branches will also give few branches to which will go to the choroid plexus or to the temporal horn. Now, anterior choroidal artery, as we can see, it enters, here's the optic tract going posteriorly, so anterior choroidal artery also goes posteriorly, and going through the choroidal fissure over here in the inferior horn of the temporal vertica of the lateral horn. Then we have the ophthalmic segment, which we already discussed, give rise to the ophthalmic artery. Then we have already discussed about the communicating segment, which gives rise to the posterior communicating artery. Now, the posterior communicating artery, if it continues as the posterior communicating artery, if it is the in the embryo, usually what happens is posterior communicating artery is the continuation of the PCA, posterior cerebral artery. But in adults, if the posterior cerebral what happens, posterior cerebral artery continues as the basilar system, that is the posterior circulation, posterior part. But if posterior communicating artery is the main origin, if the posterior cerebral artery arises from the posterior communicating artery, so in that case we call this posterior communicating artery as still fetal posterior communicating artery. Choroidal segment gives rise to the anterior choroidal artery. Now, here are all the quick summary of all the branches of the internal carotid artery. Cervical segment gives no branches. Petrus segment, horizontal part, gives cortico-tympanic artery and the Vidian artery. C3 LACERUM segment gives no branches again. C4 segment, which is the Cavernous segment, gives MHT, meningohypophyseal trunk, and the ILT, infralateral trunk. C5 clinoid segment gives no branches. Then we have the ophthalmic segment, of course, will give ophthalmic artery and the superior hypophyseal artery, which will supply the anterior lobe, along with the infundibular arteries, which will supply the stalk of the pituitary gland. Then we have the C7 communicating segment, which has posterior communicating artery, anterior choroidal artery, posterior communicating artery, and the anterior choroidal artery. And these anterior cerebral artery and the middle cerebral artery are the branches, terminal branches of the communicating segment, which aren't included in the communicating segment itself. So that's all. Hope you understood a bit of internal carotid artery anatomy. See you in the next video. Have a good day. Thank you. Bye bye.